Drug dose. It is the amount of the drug which is required to produce certain measurable biological response either at once after some time of administration. The dose is taken at a time or in fractional amount within particular time to get biological response. Dosage. Determination of the amount, frequency and number of doses of drug for a patient is called dosage. Types of dose. Therapeutic or effective dose. Dose that is required to produce the optimal therapeutic effect is called therapeutic dose. ED50 or median effective dose. The dose required to achieve 50% of the desired response in 50% of the population is called ED50. TD50 median toxic dose. The dose required to get 50% of the population reporting this specific toxic effect is called TD50. LD50 median lethal dose. The dose required to achieve 50% mortality from toxicity. EC50 half maximum effective concentration. The concentration of a drug at which 50% of its maximum response is observed. LC50 half lethal concentration. The concentration of drug at which 50% mortality from toxicity is observed. Toxic dose. The amount of a substance that may be expected to produce a toxicity. Maximum dose. The largest dose of a medicine or drug consistent with safety and produce no toxic effect. Lethal dose. Amount of dose that cause death of certain percentage of experimental animals. It may or may not be 100%. Fatal dose. Amount of dose that cause the death of 100% of experimental animals or when lethal dose reaches 100% of LD 100. Booster dose. Dose that is given after some time, months or years of an initial dose to enhance the effect. That is anti-tetanus, anti-poliomyelitis. Booster dose is given after 5 years of initial dose. Test dose. Amount of drug given some initially before giving full therapeutic dose to see the response of tissue to the drug is called test dose. Ceiling dose. Dose by which the ceiling effect is obtained. The ceiling effect is a degree of effect produced by increasing doses of drug eventually reaches a steady level. This phenomenon is called ceiling effect. Loading dose. The loading dose is one or a series of doses that may be given at a onset therapy with the aim of achieving the target concentration rapidly. Maintenance dose. The dose required to maintain the desired effect that is achieved by previous dose. Adult dose. According to British Pharmacology, the dose given in between 20 to 60 years of age is known as adult dose. Pediatric dose. The dose of medicament to be administered to a child or infant. Thank you for your patient listening.